This is a 20-minute bed workout for deep core and hip stability. It's designed for hypermobile bodies, but is just as effective for anyone who wants to build stability slowly and safely. This workout is gentle and sensitive to the lumbar spine while stabilizing in ways to help you reduce pain and tension in the long term. We'll be on our back for most of it. Feel free to support your head and neck. We'll flip onto our stomach for the last portion, with a modification offered if that's not comfortable for you. And of course, you can absolutely do this on the floor if that's your preference, or if you want to slightly increase the challenge. You'll need something to support your sacrum, and a lightweight thigh loop band for support is also optional. Let's get started with some relaxed belly breathing, lying on our backs. Feet should be about hips distance apart, parallel to one another. Place your feet far enough away from your pelvis so that you're not forming a straight line from your knee to your ankle. We want the knee a little bit more open than that. Rest your arms at your side, however wide is comfortable, trying to flip your palms up toward the ceiling if possible, externally rotating and opening those shoulders just a little bit. And then just make sure you've got enough elevation under your chin so that there's about a 90-degree angle from your chin to your neck. Try not to tuck your chin and lengthen your neck along the bed. This is how we're going to be positioned for a large majority of the session, trying to stay relatively relaxed in our upper body and holding just the slightest bit of activation all the way down our legs, almost like there's a light magnetic pull just continuously drawing your inner thighs toward one another but not completely together. And while you're here, we're just trying to relax and breathe. This is not about taking as big or deep of a breath as you can. We're just inhaling, letting our belly rise toward the ceiling, maybe feeling our back push into the bed. And as we exhale, just letting everything naturally collapse back into place. Similar to a baby, inhaling, belly naturally rising, everything expanding, jaw loose, neck loose. Exhaling, everything falling, everything staying nice and relaxed and loose. And trying to keep the back of the throat open, so as you inhale, feeling the cool air coming down the back of your open throat, and as you exhale, the warm air coming back up your open, loose neck and throat. And maybe every time you inhale, it's almost like you feel your collarbones expanding, the fronts of your shoulders getting just a little bit wider every time, opening up. The backs of your shoulders are getting nice and heavy, and just feeling a natural release as you exhale. Just staying here for a little bit longer, breathing gently and comfortably. Diaphragm working, so long as that belly is moving up and down. On your next exhale, you're going to slow it down just a little bit. We're going to begin activating our deep core muscles, the transverse abdominis, the corset, and our pelvic floor. So slowly exhale and then begin to deepen that exhalation and just draw that corset muscle in, gently hugging your spine. Pelvic floor also gently drawing up and in, and inhaling and releasing. And just continuing to do this, slowly moving with our breath. Again, this is not about how big or deep or hard we can go. A slow and gentle inhale, and on your exhale, nice and slow, drawing your corset and pelvic floor up and in, just gently hugging the spine, activating those muscles, still not allowing ourselves to hold any tension in the neck or jaw. If you want to bring your hands to your abdominals to help you feel this activation, go for it. We're going to continue deepening the exhalation here, moving into full pelvic tucks. So on your next exhale, draw your deep core up and in like you're bracing to be tickled while you have to urinate. And then just continue gently pulling that pubic bone forward a little closer to the rib cage. Just gently shortening that space in between your ribs and your pubic bone. Very gentle movement. Inhale and release it. Exhale, order of operations. Pull your deep core up and in first. Then slowly tuck. Pubic bone gently coming toward the ribcage. Low back pulling toward the bed. Just your deep core working here. If you feel your glutes starting to engage, we're going a little too hard. You don't want to feel any shaking. And if you feel like you're engaging so hard that it forces you to hold your breath, just let up a little bit. And you've got this. Just keep moving with your breath. Inhale. Belly and back push away from one another. Exhale, gently hug your spine, and then continue pulling that pubic bone through, shortening that space, rib cage to pubic bone. And again, if you want to keep your hands on your abdominals anywhere, we want to make sure as we bring that pubic bone toward the rib cage, we're continuing to feel a compression, a hugging toward the spine. We're not feeling a pushing out and into our hands. And just keep moving with your breath. We're going to move into some lateral breathing here, which is breathing through core activation. On your next exhale, go into your pelvic tuck like you have been, and then on your inhale, I want you to gently hold your pubic bone where it is, holding that tuck, and inhaling just into your upper abdominals. So your lower abdominals, rectus abdominis, holding that pubic bone in place, steadying your pelvis while you inhale into those upper abdominals, still staying heavy in the backs of our shoulders. Just continue breathing here. Hold that pubic bone. So inhale into those upper abdominals, hold the lower abdominals. Exhale, ribs close a little bit more toward one another. Teaching the core here, activation versus engagement, holding gentle activation so we can keep our pelvis steady. Okay, go ahead and release that. Good work. We're going to move into single leg lifts. Grab whatever you're using to support your sacrum. Place it under your sacrum so that it gently tilts your pubic bone toward your ribcage. We want to create a gentle pelvic tuck here. So it's a very slight lengthening of your lumbar spine as well. And you'll also notice that this lengthens the space in between your hip flexors versus where we were before. So each time we go to lower our foot, we're going to have to work just a little bit harder to keep our pelvis in this gentle tuck, just creating a little bit of an additional challenge for our lower abdominals. When you're ready, we're going to start with our right leg. On your exhale, compress your core up and in, then begin to draw that knee up towards your hip bone, not passing your hip bone. Hold it there. Inhale, lower. We're going to repeat this moving with our breath, trying to make sure that our pelvis does not move the entire time. So exhale, core compresses, knee comes up toward the hip bone, pubic bone stays exactly where it is. Inhale and lower, pubic bone staying exactly where it is. And just continue moving with your breath. If you're unable to lower your foot all the way while holding that pubic bone, that's okay. Don't go all the way to the bed. And just keep moving with your breath. Move at your own pace. Everything here just nice and slow and controlled. Exhale, core compresses, hip flexor starts working. Hold everything, and then inhale, lower, holding those lower abdominals. Okay, release it. We're going to go ahead and do this on the other side. So when you're ready, on your exhale, core compresses up and in, and then knee comes up toward that hip bone, not passing it. Inhaling, lowering that foot toward the bed. Really trying to stay as relaxed as we can through our neck, our jaw, our throat, as we inhale and as we exhale. Just maintaining a gentle activation in that right inner thigh, right oblique, really helping to steady you and stabilize you on that other side. Keep going, you're almost there. and release it. Staying right where you are, we're going to move into a progression of this move, which are leg changes. On your exhale, exact same thing, compress your core up and in, bring that right knee towards your hip bone, not passing it, 90-degree angle with the leg. Hold it here for an inhale, and then on your next exhale, really compress that core up and in, and then switch legs mid-air, so your left knee is up by your hip bone, right foot is on the bed. Take an inhale to prepare, and then same thing on your exhale, really compress that core up and in, smoothly switching legs mid-air. And I definitely recommend bringing your hands to your abdominals for this one to just make sure that we're doing compression, hugging the spine, not pushing out and loafing as we do this more difficult movement. We're almost done. One more. Exhale, switch, and release. Take a breath. Those are not easy. All right, staying here, we're going to move into leg extension pulses. We want to really make sure that we're activating our abdominals for the duration of this. If you need to keep your hands on your abdominals just for that proprioceptive awareness, go for it. On your exhale, draw your abdominals in and straighten that right knee, keeping your thighs in line with one another. Take an inhale, and on your next exhale, you're going to gently lift your thigh just a centimeter higher, leading with your knee, and then inhaling, lowering back to the original position, thighs in line with one another. This is a very slow, gentle movement. So exhale, teeny tiny lift, inhale, teeny tiny lower, holding those abdominals the entire time. Good. Inhale, bend the knee, lower the foot. Exhale, straighten the left knee. We're going to do the exact same thing. Take an inhale. On your next exhale, hold your abdominals, gently lift that thigh a little higher. Inhale, lower, back in line with the other. Move nice and slow, teeny tiny movements here, staying loose in your upper body if you can. Good, go ahead and release that. We're going to do this one more time on each side. On your next exhale, straighten that right knee. Take an inhale. Exhale, teeny pulse up. Inhale, lower, holding the abdominals the whole time. Just keep going, you've got this. Good. Go ahead and lower that one. One more time, left side. On your next exhale, straighten that left knee. A teeny tiny movement on your exhalation, leading with your knee, keeping that kneecap facing the ceiling. You're almost done. Woo, go ahead and release it. We're going to move into an isometric external hip rotation. This is the point where you can grab your thigh loop band and use that if you want to just help hold you in. We definitely don't want to add any resistance. I'm going to use it so you can see it done this way, but again, you don't have to. This is optional and definitely something you may want to avoid if you think it may create a little bit of unnecessary pressure on your tissue or tendons. We're going to get into the same position we have been, except this time bringing our feet close together. We're going to keep our heels together and then turn our toes outward. And from here, on your next exhale, go ahead and tuck your pelvis, pulling your abdominals in and just shortening that space between the ribcage and the pubic bone slightly. Hold this here, take an inhale, and on your next exhale, gently pull your knees apart, driving the outsides toward the bed using your glute medius. So you want to feel it on the back outside of your glute. And we're just going to hold it with our knees open a little bit beyond a neutral hip position. So this takes us into an external hip rotation with our pelvis in a gentle tuck. Holding it here, using our glutes to gently hold the knees open, using our abdominals to hold the pubic bone and hold the pelvis in a tuck, slowly activating our gluteals here. You may be feeling this already. You may not be feeling it yet. That's okay. As long as you don't feel any pain or negative sensations in your lumbar spine, you're doing great. Just keep breathing nice and smooth into your upper abdominals, using your lower abdominals to hold that pubic bone. This is not easy work. We're going to stay here for a little bit to really challenge those deep gluteal muscles. If for any reason this feels like too much, you start shaking, you feel any locking or cramping, you release and go into your neutral rested position. That's okay. Listening to our body is what is most important. Just a little bit longer here. Hang on. Okay, go ahead and just bring your knees in closer toward one another, more neutral position, releasing the engagement, the effort. We're gonna stay here though. We're gonna do this one more time, except this time we're gonna focus on each side individually. On your next exhale, tuck that pelvis using the abdominals, and then gently pull your knees open just like we were before. Take an inhale here. This is your neutral now. On your next exhale, you're going to gently pull your right knee just a little bit more open, just a teeny bit. This is a slow, controlled movement. Inhale it back to where it was. These are teeny tiny pulses. Exhale, open that knee just a teeny bit more. Inhale back to where it was. The deep core doing a lot of work here to make sure that the pelvis stays steady, so we're only using that right side gluteal. You've got it. Okay, release to that neutral position. Take a breath, and on your next exhale, pull your left knee open just a little bit more. Inhaling back up. Exhaling, gently pulling open just a little bit more. Trying to use that right leg to help stabilize you. Right glute staying activated and isolated the entire time. Just keep moving with your breath. And release it. At this point, we're going to move onto our stomach. So go ahead and remove the support from under your sacrum. Remove the band if you're using it. If getting on your stomach isn't comfortable for any reason, go ahead and stay on your back in that neutral position. Also stay here if you have any severe neck issues. And then flipping onto your stomach, you may want to use something under your forehead to just support you so that your neck is in a more neutral position. We want to be relatively relaxed in the neck here. So again, if you're not able to do this and find relaxation in the neck, totally fine. Just flip over onto your back. Arms straight down at your side. If you're on your back, palms up. If you're on your stomach, palms are on the bed. If you're on your stomach, take a minute and gently tuck your pelvis toward the bed using your abdominals, not your glutes. We want to make sure to protect the low back here. And when you're ready, on your exhale, just gently lift the front of your shoulders away from the bed a couple of centimeters. If you're on your back, you're just going to do the opposite and gently pull the backs of your shoulders toward the floor, just a little bit. We're looking for literally 1-2 centimeters, just a gentle activation of these teeny tiny stabilizer muscles. We shouldn't feel any shaking, no muscle tension. It's just a very, very gentle external rotation of the shoulders. Just keep breathing. Go ahead and release it. We're going to do this one more time, just an isometric contraction of these stabilizer muscles. So when you're ready, on your exhale, pulling the front of your shoulders away from the bed, or pulling the back of your shoulders just a little closer to the bed. Again, very gentle movement. You should not feel any muscle tension, shaking, cramping. Just breathe. Keep that pelvis gently tucked. Go ahead and release it. Okay, we're going to move into the last exercise of this session. And we're going to take what we just did one step further. So on your exhale, I want you to do the same thing and gently lift your shoulders away from or toward the bed, whichever direction you are. And then I want you to pull them just a little bit further. So now you can feel just a very gentle muscle engagement. And we're not doing any pulling of our shoulder blades either toward our ears or toward our pelvis. We are just gently lifting them toward the ceiling if we're on our stomach, and you're just gently pushing them toward the floor if you are on your back. Go ahead and release that. We're going to do this one more time. This is the difference between activating and engaging the muscles in our shoulders. Activation versus retraction. So when you're ready, on your next exhale, go ahead and first pull into activation and then continuing engaging those muscles. Think about the rhomboids attaching in between your two shoulder blades, just pulling them a little bit closer together. Opening the front of your shoulders, whichever direction you are. Breathe nice and slow. You've got this. And release. Whew, that is not easy. Give yourself a pat on the back, maybe not literally. You did really great work today. This is a lot of mind-body connection. I hope it's helped you feel a little bit more stable and comfortable in your body. I'll see you for the next one, Bendy Friendies.